Hi there, my name is Dr. Vin Tran from Priority Health Medical Centre. Today I just want to acknowledge how difficult it has been for you all, particularly with accessing face-to-face consultation, as during this pandemic that has been a very big change for us as well as for you in providing your health care. And at the same time, we do want to let you know that there are a number of good reasons why we are doing what we are actually doing. So to clarify things for you, there are three case scenarios that we are actually trying to avoid at this particular point in time during this pandemic. So the first case scenario is we want to avoid the spread of disease, particularly COVID-19, in the waiting room. Because the problem here is that COVID is very infectious. It can stay on surfaces for days and days, and also with the waiting room, it is sometimes very difficult to maintain social distancing. So with that in mind, the waiting room is still currently closed at this point in time. The second case scenario that we're actually trying to avoid is the spread of the common cold, particularly in the waiting room as well as face-to-face consult. And the reason why, even though the common cold is actually not that serious, it will create a false alarm for us as well as for you, as well as for the people that we see. And the reason for that is that the COVID-19 can present itself like the common cold, so that when you do have the common cold, particularly during this period, you will then have the dilemma of whether we should test you for the COVID-19 or not. And as a general rule, at this current point in time, as of the 28th of June 2020, we would consider testing all patients with common cold symptoms. So the problem here is that even though the common cold is not very serious, it will create a false alarm for the staff as well as for you as patients. So that is one thing that we do want to avoid as well. The third case scenario that we're trying to avoid is, say for example, we as clinicians see you as a patient or see someone else as a patient, and then a week later we get a phone call from public health, for example, to confirm with us that the person that we've seen about a week ago has now confirmed COVID-19. And so the challenge for us then is we would have to work out whether we have close contact with this person or not. And then if we do, we then will have to make sure that we contact trace all the people that we've seen from that patient onwards, as well as all the people that or the other people that we may have been in contact with, as well as the people that they have been in contact with. So as you can see here, that it will actually create a very big problem for us as well as for you, as well as for the people that we have actually seen during that period. So that is definitely one case scenario that we're trying to avoid. So what kind of procedures or protocols that we have in place or strategies that we can implement in order to reduce these three scenarios? So the first thing that we're going to ask you is that if you do have a common cold, stay at home and give us a call so that we can do a telehealth phone consultation with you. Now, if we do need to bring you in, we will make sure that we'll bring you in, but in a safe manner and with the appropriate precautions in place. The second strategy that we're going to use is that all face-to-face consults will still have to have a telehealth phone consults beforehand. And in order for us to do two things really, one is that we can try and work out whether we can try and solve this problem for you through telehealth or phone. But also, if we do think that you need to come in, then we will take certain precautions and get you to take certain precautions in order to minimize the risk. So the third thing that we're going to implement is whenever we see you, we're still going to practice universal precaution, wearing mask, gloves, as well as gown, but also maintain social distancing, as well as keeping the contact to less than 15 minutes. So hopefully I've clarified a number of issues for you. And if you do have any further questions, please don't hesitate to give us a call or email us. So until next time, please do take care, and please remember to wash your hands regularly, avoid touching your face, mouth and eyes, and also practice social distancing. So thank you again for joining us today. Bye for now.